So this is my fourth day of recovery after my upper arch extractions and my immediate denture placement. So I'm going to run the same 10 metrics again that I have been, just so the data stays consistent and we can actually look at the trends instead of just going by how I felt that day. So my pain is still a 0 out of 10. I'm not taking Tylenol anymore, and Motrin's very occasional. And that's for inflammation control, not because something hurts. So one thing that's really noticeable to me is how much better my mouth feels now compared to how it did before surgery. I was dealing with a lot of recurring infections and abscesses, and now that's completely gone. So functionally, there's no pain limiting anything that I'm doing. Swelling, my swelling continues to go down. It's pretty much non-existent now. Sometimes it just fluctuates slightly depending on the time of day, how long I've been standing up, talking. And that usually appears slightly just in the upper lip region. But I think from like a normal conversational distance, it's really hard to tell there's any visible facial swelling. My speech is pretty much automatic now. I'm not thinking about it when I talk. I don't have to slow down to pronounce certain sounds. And there's really nothing in my day-to-day conversation that's being affected. As far as denture wear time, I wear the denture all day without needing to take it out for relief. Obviously, I do for hygiene purposes to clean it after meals. But other than that, really no need to take it out. So for calories today, I was at 2,000 calories. So that's the first day I'm back in the supposed calorie range, and I'm not operating on a deficit. So that means my body actually has the energy that it needs for tissue repair instead of pulling from its own reserves. My fluids today were 80 ounces. It's been pretty consistent over the last several days. So the benefit of that is good fluid intake supports circulation, lymphatic drainage, medication delivery. And you can actually see the effect in how the residual swelling keeps trending downwards. My protein, I was at 95 grams today. So that keeps me right in that therapeutic range for wound healing. It means there's a pretty steady supply of amino acids for that soft tissue repair and the stabilization of the bone grafting I received. So once you get a system down for this, it's not difficult. It's pretty repeatable. It's just getting that figured out. So my sleep is still the one variable that I don't really have locked in perfectly yet. It's not because of pain or the denture or any sort of discomfort. It's more about like routine and positioning. So I think I'm at the point now where I don't have to stay reclined to sleep. I can sleep pretty much flat. So that should really help with my sleep quantity and quality. So we're tracking collagen. Today I got 11 grams of that. So the goal is to keep those specific amino acids available. So when the body moves into that tissue rebuilding phase, it has all that available for quicker and healthier tissue reconstruction. So for my overall comfort and function, from a comfort standpoint, this is the first day where the denture really feels less like something I'm adapting to, and it's more of like my normal baseline. So I went out, I ran some errands, talked to people, and I wasn't really thinking about how I looked or how I sounded. I think for day 4, that's a pretty big milestone. So just in summary, right now on day 4, my pain's a 0. My swelling is extremely minimal, very localized to the upper lip. My speech is fully functional. My calories, protein, and hydration are all right in that therapeutic healing range. My denture is stable, wearing it full time without any problems. And my overall comfort in public just continues to improve. So I think we're moving in the right direction.